Universal health coverage quite simply means that everybody can access the health services they require without undue financial hardship.
In addition to it being accessible, equitable and affordable, it means that there are systems in place and those systems are set up sustainably because we have situations in Kenya where there's a beautiful hospital but it's not well stocked or there's not enough medical professionals in place.
As Kenya, in terms of realizing universal health coverage, we're not as far behind as we were, but we're not where we need to be. In the past decade, more specifically the last 5 years, the previous administration focused very heavily on realizing UHC by creating a package of care, essential services, and also investing in UHC. However, they did so in a rather problematic way. They focused on 4 counties without actually doing the due diligence to understand what the counties' needs were. They didn't do so in a participatory manner, contrary to the requirements of devolution, and they didn't involve citizens. So where we stood is, for many citizens, they didn't understand what it meant for them to be part of this UHC experiment. Many of them enrolled into services without actually appreciating what that meant on a day-to-day basis.
And in terms of the stigma and discrimination that we continue to face in the health facility, it's one of the hindrances that affect us when accessing the UHC, and also the punitive laws that are there in the country. So UHC should be able to, key population should be able to access the quality and affordable, accessible services at the health facilities, and also they should not be left behind.
However, we also saw some really good things happen in the last 5 years. So for one, the National Health Insurance Fund expanded its coverage, not just focusing on the formal employment sector, but also allowing for self-participation into the fund, which then meant if you are a member of the fund, paying 500 shillings a year, you'll be able to access health services in many public hospitals. There are many issues with NHIF and how it's been deployed. However, being able to pool resources is an important part of universal health coverage.